All right, welcome back. We like these Fridays now from here on. Soon we get to predict games and nerd out on sports. So we're going to talk about headaches this week and go through, some of the factors that are involved with headaches, what you can do conservatively, and obviously what we offer from a headache standpoint. Dr. Peters is going to talk about what's coming up.
So kind of coming up from some of these live talks, we have a plan, and it's kind of aligned with the American Chiropractic Association. October is actually Chiropractic Health Awareness Month, so their big campaign is Chiropractic First, hashtag Chiropractic First. So we'll probably be throwing that out there, and basically what that means is it's a conservative approach to pain management. So, yeah, exactly. When I was working in the VA, that was kind of a big thing, right? Like, we're trying to get patients and veterans and off of opioids into safer alternatives. So we're going to kind of break that down in October and go through a different topic each week. So the first one is going to be safer alternative than opioids. So we'll kind of compare what chiropractic can offer to those patients that have been on opioids for a long period of time, or even as something they need to at least try chiropractic before they attempt opioid therapy. And then second week we'll go into the cost effectiveness of chiropractic. That's a huge thing. We are very, very cost effective, and a lot of people don't understand that. But if you tell them how they can save money, I think everybody will listen. And lastly, spine surgery rise. We've seen a dramatic increase in spine surgery, whether it's fusion, in particular fusions, but we haven't really seen a rise in outcomes and successful outcomes. And funny enough, I guess it's not funny, it's kind of sad actually, but the best predictor of whether you're going to have spine surgery or not is actually how many spine surgeons are in your area. So that's not good. Like, that is very, very bad. So we're trying to be a conservative approach to pain management, be that portal of entry, and then from there we can kind of quarterback and decide, okay, is this patient going to respond to conservative care, whether that's chiropractic or physical therapy, acupuncture, or is it something that needs a physiatrist, maybe an injection, or do they need a surgical consult? So October, Chiropractic Health Month, we'll kind of go with the hashtag Chiropractic First, and then go from there. So now we'll kind of get into the headache stuff. That's just a little preview of what's to come.
I would be Jimmy Fallon for sure, and he would be Justin Timberlake, because I can't.
Okay.
I can't pull that off. I can't sing or dance, so I can't even pull off Jimmy Fallon. So we're going to talk about headaches. The thing with headaches that's interesting is that there's lots of different factors to headaches, and it's one of those things, like even migraine headaches, it's sort of an enigma. Even within the highly specialized headache world, they don't know whether they can't figure out whether it's a vasoconstriction, meaning the blood vessels tighten down, or a vasodilation problem. And they think it's kind of a back and forth problem between those two. So one of the factors that's obviously involved in headaches is musculoskeletal. So muscles in the back of your head that a lot of people poke around in, those can cause a lot of very specific headaches behind the eye, over the top of the head in like a mohawk pattern, or in a ram's horn distribution where it kind of wraps around the ear, or even gives you like a fullness to the ear. We talked earlier about TMJ, and that's another thing that can also cause headaches. Those are a little different. They're not as specific referral patterns as what these little suboccipital muscles can cause. So if you have stabbing pain behind one eye, or if you get like almost it feels like there's water in your ear, or a fullness in your ear, or a mohawk pattern type headache, that's very specific to the musculoskeletal world, to muscles and joints in particular. The other factor is the joint. So up in the upper part of our neck, there's a joint complex that's basically three different vertebrae: the occiput, the atlas, and the second vertebra, which is C2, or the what they call the axis. Those three joints have a lot of nerve receptors, and actually in those little muscles that I was just talking about, there's approximately 10 times more muscle or more nerve innervation and more mechanoreceptors in that spot than an entire spine combined. So if you took all of the little mechanoreceptors, these nerve receptors, and the rest of the spine, you have 10 times more receptors in these tiny little muscles up here. There's three of them that make a little triangle up there. Those muscles are just loaded with receptors, so they can do some really weird things. A lot of times, from an assessment standpoint, that's what we look for, and we have to. The only way we can assess that is through our hands. Like, we can't really do any other diagnostic testing to the joints and the muscles up there that's reliable as us actually feeling around in there and finding some of these positive referral sites, or even just dysfunction in how the joints work. And so we would address those with various different techniques to address the muscle and the joint. The other factor that's really important, especially in women, is hormonal balances. So the estrogen progesterone balance is very big, especially in chronic migraine sufferers. That's a huge thing. And just like we talked about, like the anti-inflammatory type of diet, like that's a very important thing to consider with headaches. If there's one supplement that you absolutely need to look at if you haven't and you have headaches, is magnesium. And not a magnesium that's in just your average like 1-a-day vitamin, like a multivitamin. It's not enough. You need to get somewhere between 200 and 400 milligrams of magnesium from like a magnesium oxide, like a pure magnesium. That's going to help. There's an herb out there called feverfew that helps a lot with headaches, so look into those things. And we try to address all of these different factors. And then of course there's stress and sleep factors that we need to address with headaches.
Yeah, so kind of going on that nutritional component, I'm not sure in the essential nutrition pack, is that enough, or we got to?
It's enough.
Okay, so we actually have a essential nutrition pack here through Anabolic Labs, and the omega-3 fatty acid, the calcium, the vitamin D, and the magnesium, which Corey was talking about, you're going to get that all in one pack. We really encourage people with headaches to kind of pick that up, and it'll address that nutritional component while we kind of address the musculoskeletal, and then trying to decrease stress, decrease anxiety, because those are generally the highest times. A high percentage, greater than 80% of participants reported stress as a major factor for migraines. So most people that come into our office with migraines, stress is a big component of that. Like Corey talked about, we also see tension type headaches. Spinal manipulation is superior in the short term and in the long term. So that's really great for what we do in chiropractic, being able to help. And then there's another type of headaches called cervicogenic, meaning it's coming from your neck. We're kind of the cervical spine experts in the conservative care world. So we're talking little exercises to kind of strengthen the deep neck flexors and being able to work with the muscles, because these are overworked, and they kind of drive a lot of the other type, like even migraines, you'll see the tension type headache will kind of drive some of those, because if this starts to hurt, we know stress is a factor, so that's going to increase stress and anxiety, because oh no, my head hurts, I'm starting to get a headache, and then that'll actually cue the migraine. So we see good results in being able to treat the musculoskeletal system, even for the migraines, which we're not totally sure whether it's a vasodilation, vasoconstriction, and then some people even think it's more neurogenic in origin. So it's kind of a mess when you get into the migraine world. Nobody really knows exactly, but we've found really great success kind of treating the musculoskeletal system of the thoracic spine and the neck, and working with those proprioceptors back here, which basically just tell you where your head's at in space, and it kind of decreases the pain modulation. So it's descending inhibition. It's good, healthy input that's going to kind of decrease the headache symptoms. And the official disability guidelines actually recommend 12 visits over 6 weeks for people with headaches. So from a Bronfort report. So from a diagnostic standpoint, we're doing the physical exam to rule out any serious pathology, and then we're getting right in there with our hands and seeing if we can recreate those headaches, push on the muscles, turn the head, move the joints, and seeing the outcome that comes from that.
Yeah, and I can, just from experience, we had a patient in here that had basically, she would go to the hospital once every other week, and they would put her on like morphine drips and things like that. And the one component that she hadn't addressed, she'd actually done everything right from like a nutritional standpoint. The one thing that hadn't been addressed was kind of the musculoskeletal portion of it. And she did really well, which is kind of surprising, having those severe headaches where she would actually have to go to the hospital, get on an IV morphine drip and that kind of thing. So, and we don't always know. Headaches are it's honestly, the treatment is kind of the trial. Like if you start to see changes in headaches, it's not going to be immediate. They're going to become less frequent, so they're going to become more intermittent. They're going to become less severe, so they might still be there, but they're not as bad. Or you may even get days where you don't get them, or certain triggers that don't cause them. So those are the other things. And if you're a chronic headache sufferer, you've probably gone through that, but there are certain triggers to look for with headaches: caffeine, chocolate, certain foods, certain smells. Like those are all things that we have to, and we have a list of things here that we have for triggers that you can go through and kind of check off, whether that's a trigger for you or not. The other thing with stress is clenching. We talked about that. So people that are stressed clench their jaw a lot, and those are things that we look for when we're assessing for headaches. And then we don't just say, hey, don't be as stressed. We actually try to do something about it, not only through like our treatments, like while you're here, we try to make that like your best 15 minutes of your day, but we also have a thing called the relaxation response that anybody can search and find. It's from a medical doctor that studied the stress response and kind of came up with a way to change that stress response through, it's not true meditation, but it's kind of for the layperson, but you can look that up. It's called the relaxation response. We have printouts here that we actually hand out to patients, and it seems to work. So we try to address all the factors. We're not masters and experts in every single one. I'm not a nutrition expert, but I know enough to get you to the right people if we need to. And same with Dr. Peters. We try to address as many factors as we possibly can so we don't leave any stones unturned, and try to help you the best we can with all those different factors.
That kind of gets back to just being a big advocate for you. Like if we can't help you, we know people that will be able to help you and will definitely go to bat for you. Also of caution that doesn't get mentioned enough is rebound headaches. It's basically what it means is medication overuse. Like if you have treated your headaches successfully with medication in the past, well, if you continue to do that long term, it will actually be making your symptoms worse. Like you'll take the medicine, feel better for a little bit, and then the headache will come back and it'll be worse. So chiropractic is a great adjunct to that. Like, hey, as we're trying to decrease the medication, which is going to be a little tough in the short term, you're going to have the headaches, we can kind of come in, hopefully help decrease that, and then over the long term, that will really help you, okay? Storage almost full.
We didn't get anything. We haven't lost the iPad this time, so we're doing good there. And with those, that's a good point. Like if you are taking medications for headaches and they're starting to get worse, just ask your doctor about that. We can't take you off medication, but realize that there's like a weaning off process for that where they're actually going to get worse for a couple weeks. And it's going to take 4 to 6 weeks to change that. Same thing with like if you're taking a magnesium supplement or a feverfew, you need to give it 4 to 6 weeks to work. Don't just take it once, think it's a magic bullet and it's going to work. And I take the Essential Nutrition Pack, and I don't have headaches, but it's preventative. Like I just make it part of everything it's something I do every day, and that's something for headache sufferers. Like you're going to make that part of your everyday supplementation to help you prevent the recurrence of headaches and things like that. So that's a good point to bring up about the rebound headaches. So if you do suffer from headaches and you have questions, you're more than willing to, or more than happy to give us a call, and we'll try to answer whatever we can. We don't have the answer for all of your headache problems, obviously, especially the sort of people that have suffered headaches for decades, but we'll give it the best shot that we possibly can and be in your corner and try to help you out as much as we possibly can with that.
Right. Sports pick'em?
Yeah, I don't even look at Chadron State's schedule, so again, I'm not wearing red, and it seems to be working. So the diehard Husker fanatics that come in here, they don't like me very much on Fridays because I don't wear red. So
Jolynn always wears red in the Husker shirt, so she covers the office.
And she knows nothing about sports, so that works out great.
Perfect.
So she'll be the one to win the March Madness pool here, what we have,
exactly.
Because she knows nothing about basketball. So Nebraska plays Illinois this week. Illinois
3 touchdowns.
3 touchdown favorite.
Illinois
is a work in progress. They've had a bunch of coaching changes. They're young. They've got a redshirt freshman quarterback. I think it gets ugly in Lincoln this weekend, and I think we win. My final score is 45-7. I think it gets bad.
I'll take Illinois in the points, but I mean Huskers are going to win. But man, 3 touchdowns is a lot to a team. They beat us last year.
Yeah.
Obviously, they have a new coach, Lovie Smith, big name, but he's got a lot of work to do there in Champaign before they come around. And then Creighton Soccer, I got my Creighton Blue on today. They play at St. John's, I think today, maybe tomorrow. I think it's tomorrow. So hopefully they get another big conference win before they return home against Butler, who's tied right there at the top of the conference. They got a big win against Loyola, gave them their first loss 3-0 on Tuesday. Yeah, so exciting sports season.
I picked Creighton to win 1-0 in a shootout.
They won 4-1 at DePaul, which I was there, and Riggs Lennon scored all 4 goals, so that was pretty cool.
Maybe I'm wrong.
Corey's soccer advice is
it's pretty bad.
Yeah,
it's pretty bad. So, and then the other big game we have in the Big Ten is Wisconsin-Michigan. So, I am actually taking Michigan because Wisconsin just can't keep up this schedule, and I take Michigan in a 14-10 battle.
I have no idea. I'll watch it. I don't know. I don't know what the spread is. I don't know. Former 49er coach Jim Harbaugh, hate him for leaving, but man, he can really coach, so I'll go with Michigan too.
And one thing before we leave, I want to congratulate Jace on being the official Creighton Blue Jay, especially for soccer, chiropractor, which is very cool. And it's just that's a really cool thing to do, especially in the first year of practice. Those things are really hard to break into. So I want to congratulate him on being the official Creighton Blue Jay. So if you have any questions about sports chiropractic, he's your guy because he's actually an official chiropractor for a team.
Yeah,
I am not. I'm officially the team chiropractor for nobody.
He's officially the chiropractor for the official chiropractor. Corey's my chiropractor, so I guess that's something, right?
That's it. So we'll see you next week. Thanks.
Thank you very much.